For Canada's most vulnerable, the health crisis known as the tripledemic is terrifying.
Every time Cohen coughs, I get a shot of anxiety.
2-year-old Cohen Peary of Burlington, Ontario, struggles with chronic lung disease and asthma. Cohen is a frequent visitor to hospital emergency departments, which are being overrun by COVID, RSV, and flu patients. For his most recent emergency, the Pearys waited for 2 days in the ER.
People receiving care in the hall.
And the waiting room is just packed. It's chaos.
Health Canada's tracking of cold and flu illnesses has seen a jump in the last 10 weeks that records are available, with influenza cases spiking far above expected levels for this time of year. Managing care for so many sick children is now leaving some adults in danger.
That day's coming where the pain's going to return, and it scares me.
In Winnipeg, Stephanie Sanders was receiving infusions that eased her painful endometriosis. But staff at her pain clinic are being reassigned to help with a wave of children suffering from respiratory viruses.
It's hard knowing how many of us will or might go back to the pain we were dealing with before because of not getting this treatment.
The somewhat encouraging news, Health Canada says RSV is stabilizing. But for now, doctors and nurses say they're barely hanging on.
For influenza in particular, for the patients that we actually test, at the end of October, we were seeing a positivity rate of 10% in terms of the patients that we actually got a sample and had it tested in our lab. That is up to 30%, which is a significantly high number.
All of this as parents across Canada struggle with a persistent shortage of children's pain medication. The shortage Health Canada says it's addressed and says distribution of foreign labeled products is underway. Cohen Peary's parents say he's doing better, and they're doing whatever they can to avoid future ER visits. Ross Lord, Global News.